All right, let's talk about a career path you've probably never seriously considered, but maybe you should. We're diving into medical billing, but trust me, this isn't what you think it is. We're talking about a blueprint to something pretty incredible. Okay, just look at this number, $80,000. Now, for a lot of folks, that's a great yearly salary, right? Something you work really hard to get to. But what if that wasn't for a whole year? Yeah, you heard me, $80,000 a month. I know, it sounds completely insane, but this is the kind of potential we're talking about at the very top of this field. So obviously that brings up a pretty big question. How in the world is that even possible in medical billing? I mean, we usually think of it as an admin job, right? It sounds nuts, but the answer is surprisingly simple. It's not about just being a medical biller. No, the people hitting numbers like that are doing something totally different. They're not just punching in claims. They're strategic masters who follow a very specific blueprint, a blueprint that makes them absolutely essential. And guess what? It all comes down to just three core skills. So this is it. This is the whole path. Just three steps, three skills, and each one builds right on top of the one before it. If you master these in this order, you stop being just another employee and you become a critical part of the whole operation. So let's get into it. First up, the foundation. Okay, skill one. We're calling this the foundation for a reason. You wouldn't try to build a huge building on a shaky base, right? It's the exact same thing here. You cannot have a high-level career in this field without being a rock star at data entry and record keeping. Period. It all starts right here. I mean, really think about it. Every single cent that flows through a hospital or a doctor's office, it starts as one little piece of data. A name, a date, a policy number. This isn't just mind-numbing typing. You are literally building the financial foundation of the whole practice. Get one digit wrong, and bam, a claim gets denied. Payment gets held up for weeks. It's a huge deal. So what does it mean to be a master at this? Well, it's about absolute, laser-focused accuracy. We're talking zero typos, zero mistakes. It's also about speed, being super efficient without letting that accuracy slip. And finally, you have to know the record systems, the software, inside and out. This step, totally non-negotiable. Okay, so once that foundation is rock solid, we can build on it. That brings us to skill number two, the language. If data entry is the bedrock, then medical coding is the special language that gets built on top of it. This is where you go from being just a data person to being a translator. Seriously, every single thing that happens in a doctor's office, a checkup, a blood test, a major surgery, it all has a specific universal code. A medical coder's job is to look at the doctor's notes and translate all that medical jargon into these codes that insurance companies can actually understand. They're like the crucial link between the doctors doing the work and the companies paying for it. To really master this, you have to be fluent in these coding languages, things like ICD-10 and CPT. You need an almost obsessive attention to detail because picking the wrong code can change everything. And here's the kicker. Medicine and insurance rules are always changing, so you have to be committed to always learning, always staying up to date. So if you think about it, these first two skills, data entry and coding, are what you'd call technical skills or hard skills. They're the what you do and how you do it. But there's one more piece to this puzzle, a missing ingredient that takes you from just being a good technician to being a true master of your craft. And here it is, skill number three. We're calling it the bridge. This is that missing piece, the power skill. It's what connects all your technical know-how to the real messy world of people, and it is the art of professional communication. And let me be clear, this is so much more than just being nice on the phone. It's a strategic weapon. It's the difference between calling an insurance agent and weakly asking, why was this denied? Versus confidently stating, hi, as per policy section 4.b, this procedure is covered, so let's get this processed. See the difference? It's about talking a scared patient through a confusing bill or getting a quick, clear answer from a doctor who has no time to spare. This is how you actually solve problems. So being a master communicator in this world means you wear a few different hats. With insurance companies, you need to be crystal clear and use their own language to get what you want. With patients, you've got to have empathy. Remember, they're often scared or in pain. And with doctors and nurses, you have to be precise and get straight to the point, respecting their time. It's a balancing act. All right, so those are the three pillars, the three core skills. Now, let's put this whole thing together. Let's look at the finished blueprint, the one that truly separates the average biller from the absolute pros. And there you have it. That's the whole game plan. First, you build that rock-solid foundation with perfect data skills. Then, you learn the secret language of coding. And finally, you become the bridge, the problem solver with amazing communication. You see how each one leads right into the next? And this is the key takeaway. When you master all three, you fundamentally change your job description. You're not a paper pusher anymore. You're not just processing claims. You are now managing the entire financial lifeblood of a medical practice. You become someone they literally can't afford to let go. And that is how you unlock that crazy potential we talked about at the very beginning. So now you've got the blueprint. The only question is, what's your first step going to be?